Hi everyone, welcome to the AIHM Wellness webinar. We're really glad that we're here. We've gotten through another week and we're very, very honored to have Laura Farr with us today as the AANP, the American Association of Naturopathic Physicians Executive Director. So I just welcome you all, and as you come in, let us know where you're coming from in the chat. If you're on Facebook, just also let us know where you're coming from, what your background is, and we'll get started. So for those of you, if this is your first AIHM webinar, the Academy of Integrative Health and Medicine is a global interprofessional integrative health association working to transform healthcare, body, mind, spirit, community, and planet. So we are really an interprofessional community and welcome you all to join the integrative health community. So today it really is an honor to have Laura Farr here with us. Laura is the Executive Director of the American Association of Naturopathic Physicians and has been since 2017. And I truly invite all of you to visit the naturopathic website, www.naturopathic.org. You all have just done such a phenomenal job around the COVID crisis, and the resources are amazing, and I really encourage you all to support the AANP and really use them as a resource. Laura has also worked with the naturopathic profession since 2005 as a leader. She came from a political organizing background by training, and her advocacy work as a grassroots organizer and consultant spans over 25 years. She has deep knowledge of the complexities of healthcare reform and is an expert on how naturopathic doctors, conventional clinics, and insurers can work together to improve patient care and reduce healthcare costs. She is married to a naturopathic physician and committed to integrating naturopathic medicine into our primary care systems across the country. So Laura, welcome, and I'm really excited today for you to be talking to us about some of the issues that have been going on in the community.
Thank you for having me, everyone. I'm super thrilled to be here, although I wish it was on a happier topic than what I'm going to talk about. But as you all know, as integrative healthcare practitioners, we sometimes are swimming upstream in the challenges that we have with facing biases and institutional barriers about acceptance of more integrative and natural approaches to healthcare. And this has been heightened definitely in this pandemic and with all of the fears around COVID. So I have been speaking with a number of different organizations about a recent, somewhat concerning, maybe more than somewhat, quite concerning trend that we have been seeing. And Dr. Parker asked me to come speak to you all about it because we're definitely seeing that it impacts providers from a wide, very wide spectrum of professional specialties. So as you know, we all want to do public education to our patients and to the public about things that they can do to improve their immune resiliency, to improve their health outcomes, to mitigate symptoms, especially, you know, we're all motivated and driven by a desire to help patients who maybe have COVID or who have underlying disease conditions that can exacerbate susceptibility to COVID, to help them take care of themselves, empower them to take care of themselves at home, and to try to keep them out of the hospital system. And many ways that our providers have been doing that has been to share and communicate natural approaches and integrative medicine approaches to taking care of yourself, immune resiliency, supplements that you can take that boost your immunity or that help with respiratory health or help with underlying conditions, self-care type approach to healthcare. And what we have been finding, unfortunately, in about the last 4 to 6 weeks is a dramatic uptick in regulatory agency actions against what regulatory agencies perceive as false marketing, making claims that are either false marketing or deceptive advertising. And many of them we've seen a remarked uptick in those kinds of regulatory actions that are aimed specifically around natural approaches to healthcare. So I'll break it down a little bit into what we've been seeing, because we've spent a tremendous amount of time analyzing what's happening out there. But what we've seen, just to kind of lay out the actions that we've been remarking on, is about 200 warning letters have gone out from the Federal Trade Commission. They first started going out after like Jim Baker's of the world, talking about colloidal silver and making, some pretty outlandish claims. And then we started to see them really targeting natural health stores, who arguably some of them were also making claims that could very well be perceived by the public as false and misleading. Claims like, if you take this, it will prevent. Some very definitive claims that taking X, Y, or Z will prevent contracting COVID-19, which, of course, there are no drugs or vaccines that have been approved for that specific claim. But then we started to see warning letters starting to go to licensed acupuncturists and massage therapists and MDs and DOs who are more in the integrative medical field. Now we're seeing them with naturopathic doctors. I can't remember if I mentioned chiropractors, nutritionists. So now we're seeing kind of a more wholesale targeting of providers from every different walk of life being targeted for what they're stating on their websites, in their newsletters, in their communications to patients, and on social media. What we have noticed is that it seems to be driven by web crawlers. So they're looking for certain word combinations, but those web crawlers are very broad and they're casting a very wide net that is catching in its net things that are not necessarily associated. And I'll give a couple of examples in just a few minutes. The warning letters that go out from the FTC seem relatively benign. It says something like, hey, we've noticed that you're making something that we think is false or misleading advertising on your website. We're asking you to take that down immediately, and you have 24 to 48 hours to comply. That seems benign, but unfortunately the FTC is linked with a whole system that can trigger a lot of much more damaging implications for providers. So what we've seen is the banking system gets the FTC warning letters. So a couple of clinics that have received one of the warning letters immediately, like within days, had their merchant service account shut down and frozen by their bank. Those are shared with departments of justice. So anybody who's in Oregon, we know particularly in Oregon, the Department of Justice has an administrative rule that says that if you are saying anything false or misleading, or that isn't grounded in a substantial amount of scientific evidence, which is left somewhat subjective, that they consider that a violation of the Unlawful Trade Practices Act. So the FTC warning letters have triggered the Department of Justice sending out investigative demands to substantiate the claims that you're making. And that is something where you need to lawyer up to defend yourself if you get one of those. And they're communicating with the licensing board. So we know of at least an acupuncturist and a couple of naturopathic doctors that have had this sequence of events happen in Oregon. There was a DO office in Michigan, I believe it was, that had an FBI raid for making claims that they do IV vitamin C as a preventive measure for this and other illnesses. So it can lead to a whole cascade of things, which has us very, very concerned. And I see the quick poll coming up, which is an area where we're really finding their heightened scrutiny is in that juxtaposition of, are you talking about education around what patients can do and supplements they can take or lifestyle changes they can make? And where's the boundary between if you're selling products that you are recommending in that public education? So I am curious to know how many people on the call either distribute supplements to your patients and only to your patients out of your office, or do you distribute them through an online store or a dispensary like Emerson or FullScript? Because we'll get into nuances depending on how many people are in these different situations. So let me give some examples of what we've seen the FTC warning letters are targeting. Some of them, I will fully admit, are outrageous claims. Many providers are not very familiar with marketing laws and what the marketing laws are around false and misleading advertising and deceptive advertising. Many providers are not as familiar with the restrictions around dietary supplements and DSHEA laws as we probably need to be. We all know that dietary supplement companies are very, very careful about not making claims that, you know, if you take calcium, it cures osteoporosis. You can't say that. That is a claim that effectively it's being used as a drug to treat a disease. Dietary supplement companies stop at saying that something like calcium can promote better bone health. That's a structure function claim. It's not a claim to be able to treat disease. So admittedly, many providers have been saying things that they should not have been saying that is perceived as false and deceptive advertising for a disease claim. But where we started to get concerned is with these web crawlers that are making word associations that are maybe not appropriate, and that there seems to be the blurring of the boundaries between what is appropriate education and what is commercial speech, what actually is marketing. I think the examples illustrate this the best. So in terms of the web crawlers, we have seen one clinic had a newsletter that said, legally, you're required, if you're seeing patients in person now, you have to post what your clinic policies are around how you're keeping people safe in this pandemic. So what's your sanitation policy? How are you clean? What's your cleaning schedule? That you require patients to wear masks, that they have to stay in the car until they're invited in for their appointment. All of these things are your COVID-19 clinic policies. So in a newsletter, a clinic shared what their COVID-19 clinic policies are. And then later, at a very different part of the newsletter, they shared a protocol on, hey, it's cold and flu season, and we want to make sure that you have good respiratory health and good respiratory function. This is our protocol for things that we recommend, which does include some supplements for how do you maintain good respiratory health. The things were not associated, they were not meant to be associated, but the web crawlers seem to have linked those, and the fact that COVID-19 was in the same newsletter as a treatment protocol that included supplements on respiratory health. The FTC viewed that as an implied marketing attempt and said that it's deceptive and misleading marketing that respiratory protocol with whatever supplements were mentioned was implied to treat or prevent or mitigate or cure COVID-19. And that clinic got a warning letter for it. And I want to specify that I think in 100% of these cases, all of the clinics that do talk about supplements and their treatment protocols also sell some supplements either online through an online dispensary or mention in their materials, schedule an appointment, come in and see us, and we can help you develop a protocol specific to your needs, with the implication that they sell supplements out of the office. So that's one example about the web crawlers. Another example that we have seen, which is even more concerning to us, is the warning letters do not seem to simply be narrowly limited to just whether you're selling products or not. It also seems to be services that you may be providing. So a lot of clinics that are offering IV vitamin C have received warning letters for saying things like, IV vitamin C has research behind it that shows that it helps boost your immunity and can mitigate symptoms of COVID-19. Schedule an appointment. We offer vitamin C as a service. And that is now being seen as a marketing claim that the service that you're providing of doing an IV for something is false and misleading advertising that you can prevent COVID-19. So that to us is really starting to step into, does the FTC have a role in scope of practice? Is this a jurisdictional overreach where usually scope of practice issues like that are managed by your state licensing board about whether you can perform that service? It definitely calls into question as providers, well, what can you say? You know, can you say in your educational material that you treat diabetes or that you treat osteoporosis and that you have a certain protocol, schedule an appointment to come have a patient-centered approach to your disease condition? So it's alarming in that sense. So the algorithm is one thing, the stepping into disciplinary actions around services that you're providing is another concern. And then the third one is just, how do we as clinicians who do rely on natural approaches and natural products a little bit more than pharmaceutical products in our treatment plans, where is that boundary between how can you appropriately educate your patients and the public versus can you have an online store or can you sell products? And that's a discussion about what is public education, what is free speech, and what is commercial speech. And one of the questions that has come up is, can you have, for example, a blog or a page on your website where you're discussing, here are natural approaches to prevention, to immune support, to respiratory health, all of those kinds of things, on one page of your website. And then on another page, can you have a link to an online dispensary? Or can you say anywhere, come schedule an appointment and we will put together a specific package, a treatment protocol for you. So I'm seeing results now. So about 28% do distribute supplements out of your offices. And how do you distribute supplements? Online, 16%, in the office, 6%, or both 16%. So we're exploring this right now. We have a meeting set up with the FTC on Tuesday to try to get some clarity about what they're targeting. If there's additional educational work that we can do with our providers. As I mentioned, a lot of people just don't understand DSHEA and FTC marketing laws as well as we should. But also we need to push back a little bit on what's appropriate education and how do we empower patients to take responsibility for their health, even if that means taking vitamin D or getting vitamin C or NAC or elderberry or a lot of these different treatment protocols that we have been sharing. Where's that line and how do you not cross that line? One other thing that we've noticed, and then maybe I'll just pause and see if there are questions that start coming up, is that there are a number of conventional academic institutions and large facilities, large medical facilities that are sharing the very same information. Here's the treatment protocol. IV vitamin C can help mitigate symptoms, take NAC in these dosages. But they seem to be able to provide that educational information with impunity without receiving warning letters. And we don't know if that's because they're an academic institution. Is it because they don't have a direct link for supplement sales? Although many of these hospital systems are clearly dispensing these items to their patients. So it does seem to be skewed a little bit that who's being targeted are smaller ambulatory clinics in the integrative medicine fields across all of our disciplines, rather than large academic institutions or associations or medical facilities. So, so we want to explore that with the FTC as well. So let me pause there and see if there are questions that have come up, because there's a lot more detail and nuance to this, but I don't want to overwhelm right out of the gate. And do you read them, or should I be following the chat?
Yeah, I usually read them
Okay.
to make it a little easier for those who are online. And we do have at least one watch party online happening as well. So if anyone on Facebook wants to put any comments into the watch party, then we can also answer questions from that. So Karen Digby is asking, is allopathic primary care included? How about mid-level providers? Have you seen any letters go out to either of these groups?
So allopathic primary care, yes, definitely. We've seen several letters go out to MDs and DOs, especially in the beginning waves of, they're sending these out in batches. So they send anywhere between 15 to 50 letters per batch about every 10 days. So in the beginning waves, there were quite a few MD and DO clinics that were receiving letters. I haven't yet seen any go to nurses, which is interesting because I've seen it with just about every other provider type.
Another question we have is, I've heard that homeopathic medicines and their providers are at risk for becoming illegal. Do you have any comments on that?
So I'm following that also, and it is a little bit of a different regulatory action. So that's a process that's happening with the FDA right now, where FDA has come out with new draft guidelines for the regulation of homeopathic products. And there is a little bit of differing opinions in the homeopathic community about what the impact of those draft guidelines are, with some people, primarily the homeopathic companies, saying they're not too worried that it'll have as much of an impact. Consumer groups are saying that it could result in the removal of some products from the market, some important products potentially. And there's enough gray area in the draft guidelines that has us concerned that it could have an impact on the homeopathic community, but not that it would abolish it or make it illegal entirely. So really the question is, could we see the loss of some important homeopathic products? And are we willing to accept that potential risk? And I think most people agree, no, it's not a risk that we're willing to accept. And the language can be clarified so that it's not so gray, to provide more clarity to homeopathic manufacturers and providers. So that's where the battle is right now, is trying to move the FDA to revise the draft language so that there's more clarity, there's more guidelines about how to appropriately manufacture and dispense homeopathic products. And absolutely, you should engage in those grassroots efforts to try to get the FDA to revise those guidelines. But I do caution people, I don't think the sky is falling. I don't think that's the message that we should be communicating. Homeopathy is going to be around. We just need to make sure that there aren't these risks and these gray areas that could really challenge appropriate marketing and production.
Laura, I'd like to ask you a couple of questions just about, you had mentioned that you've seen almost all of our disciplines. Can you be a little more specific for those watching of different disciplines you have seen letters go out to?
Sure, off the top of my head, MDs, DOs, naturopathic doctors, DCs, LACs, nutritionists, massage therapists, homeopathic practitioners, lay naturopaths. That's 9, right?
Mhm.
That's the bulk of them, and
Ha-
some nutrition stores.
And have you found that this is happening in an area of the country or any one state, or is it really broad?
It's very broad. There's no pockets geographically that we've been able to identify. It seems random, honestly, which is, another indication that it just seems to be some weird word association from web crawlers. It's the only thing that we can think of, but there's no regionality to it.
And have you, I know we have a close relationship in the naturopathic community with our Canadian NDs. Have you heard anything coming out of Canada or other places? I mean, it would be a different regulatory body, but any type of similar issues?
We have not seen any of this kind of regulatory action in Canada. And, what we have seen here, and I don't know if this is just a factor of our American culture, but what we have seen here is a heightened regulatory activity across everything. So we've seen different regulatory actions happening from FTC, FDA, OSHA, local departments of consumer and business affairs, local departments of departments of justice and attorney general. There is a level of regulatory awareness and zeal in this time of COVID, which all of our attorneys and consultants that we've talked to say they have never seen this kind of regulatory activity on anything ever. So it's just something to be aware of. And the guidance that we just distributed to our community was very nuanced, that the ability to talk about educational information about natural approaches to health, treatment protocols, and whether you sell supplements or not is a spectrum of risk tolerance, where it's really, there's no clear black and white from what we can see is triggering these regulatory actions. What we don't know is, can you share educational information, as I mentioned before, just on one page? If you have educational information about natural approaches or dietary supplements and how it can help with your health, does that preclude your ability to also have an online dispensary or to promote services like IV vitamin C? Or can you do both? And at what level of juxtaposition? Can you have a blog on one page and a link to your online dispensary on another page, or is that too close in proximity? And that depends on what your risk tolerance is. We've definitely seen that the FTC is sending warning letters if there's any mention of COVID at all, with any availability of supplements being sold either in your office or on a store. So it really becomes a judgment call of, until we can get further guidance from the FTC, how much risk are you willing to take? And if you're not willing to take any risk, our strong recommendation is that if you're talking about anything related to COVID, respiratory health, viral infections, those are all considered disease, either the disease itself or disease classes. That the lowest risk is that you talk about those things and do not sell supplements at all or link to an online store at all. Or you do the reverse. You have an online store, and in your conversations or in your discussions about education, you do not mention COVID-19, respiratory health, immune support, viral diseases, which becomes really tricky, right? How do you educate patients if you can't talk about all those things? but that's an either or. So either you do the education or you do the online store, and that's the lowest risk. But if you want to do both, this is where the gray area is, and this is what we're trying to explore with FTC, is how can you do both in a way that's not false and misleading, that really does contribute to the public health discourse about self-care and how to keep yourself out of the hospital. But that's a little bit of a higher risk, and it depends on your appetite for that.
Laura, would you be able, for folks who are joining late, just quickly summarize just what the state letters are saying and potentially the legal risk?
Right. So these are letters that we've seen a surge in regulatory letters, warning letters from the FTC going to providers, primarily in the integrative medicine disciplines, that flag certain word combinations of discussions about COVID-19. If you're talking about supplements, especially if you're talking about supplements that you also sell, either in the clinic or through an online dispensary, are being flagged as false and misleading advertising, that you are making claims that something can prevent, mitigate, treat, or cure COVID as a dietary supplement. And the warning letters can trigger a number of things. If you don't come into compliance, the FTC can take their own actions, but they also are sent to banking systems. So some of the banks have frozen merchant service accounts if you receive an FTC warning letter. And they are also going to at least one state Department of Justice, which is Oregon, which also triggers an investigative demand that you cease and desist and provide substantiating evidence, or you will be found in violation of the Unlawful Trade Practices Act for false and misleading advertising. And we know that at least in that state, the Department of Justice is also notifying your medical regulatory board, which may or may not trigger disciplinary action by your licensing board.
Thanks for that update and just review for those of you joining later. There's a question coming in from Michelle Ann Conley. How are you getting your information, incidentally by individual reports, or are there public sources so that we can track this more broadly? For instance, are FTC, DOJ, OSHA, et cetera, reporting their activity?
Mm-hmm. The FTC is definitely posting their activity on their website, and I can send that to Tabby to disseminate to all of you. So every time they send out a batch, they send out a press release, and it's also posted on their website with specifics. So they will call out your clinic name and specifically say what language they find is objectionable. What they don't say is if you've come into compliance, they don't remove your information from their website. So there's a little bit of public shaming going on here too, but it does become public information. And I should add too, we have been very proactive in asking our community. So we monitor the FTC websites, but we've also asked our community to please notify us if they have received any letters and to send us specifics of not just the FTC letter, but also their response and what it was on their websites or newsletter or social media that triggered the warning letters. So that's why we've been able to do some deeper analysis in what these patterns and trends are.
Yeah, we would also just call on the integrative community to do the same, really reach out to the AANP. They are our trusted leaders on this, and to Laura. And if you get a letter like this, that will allow us to capture more broadly what is happening to our community. We have a question coming in from one of the attendees that says, I thought that in the state of California, it's within the scope of practice for acupuncturists to recommend and prescribe herbs. So I'm confused, you know, what is the issue? Is this getting into scope of practice area?
Yeah, we really believe it's getting into scope of practice area. All of these provider types, well, not all of them, but for the most part, these are licensed providers with a very specific scope of practice to diagnose and treat. And, you know, we have seen some of these warning letters where the material that was flagged said something as benign as, if you feel like you're experiencing symptoms that might be COVID-19 related, we have treatment options and we have treatment protocols for you. Please schedule an appointment. And that was flagged. So absolutely, we're concerned that this is an infringement on scope of practice. And that's one of the questions we're asking to FTC when we have a meeting with them.
And another question, I want to clarify, are you saying that even if there's no connection with a supplement being used for a COVID reason, but rather some other chronic disease, it is being treated as such, like as if it was being used to treat COVID or somehow getting flagged?
Yeah, with specific things that are related to COVID. So the particular word combinations that we've seen are discussions about treatment protocols and specifically supplements that you can use for viral infections, which FTC seems to be classifying as a disease class. So remember, the DSHEA restrictions say that you cannot make a claim that a dietary supplement treats a disease. So how FTC is interpreting this is extended to even discussions about a disease class. Like, you know, we recommend these supplements that can support the immune system against viral infections. We've seen that flagged as a disease class, even if you don't specifically mention COVID-19. Same with respiratory infections. Does that help? I don't know if that totally answered the question, but.
I think that's really great. Another question from Linda, Fessett and Buttes. This sounds like a slippery slope for CAM. Could this carry over to all complementary techniques like healing touch or other practices?
Yeah, we're concerned about it. We're really concerned about it. You know, and can it carry over into other diseases? Right now, COVID is radioactive, but is the next step going to be that you can't talk about your treatment protocols for diabetes or for osteoporosis or for, anything, right? Cancer. So we are very concerned about it, and the kind of early warnings that we have that this could be a slippery slope is, again, in Oregon, the Department of Justice, I mentioned they have a rule that specifically says any claim that you make specific to COVID, they will consider false and misleading unless you can substantiate it with scientific evidence. Their original draft of that rule was any claim that you make for any good, and they specifically use that word, any good that you can't substantiate with scientific evidence, they will view as a violation of the Unlawful Trade Practices Act, and they would allow private rights of action, so lawsuits from private individuals, to be brought forward against any clinic or provider or company, nutrition store that markets this kind of information. So the Department of Justice in Oregon is looking at this very, very broadly, not just specific to COVID, even though that's the only thing that they've implemented so far.
Laura, in Oregon, I had a question. Has there been any efforts to reach out to the DOJ there and, connect with the team that would be dealing with this?
We have, and they, not with very much luck so far. So we've had an attorney reach out to them. We actually had the Naturopathic Licensing Board reach out to the Department of Justice because the licensing board was very concerned that this was an overreach into their jurisdiction regulating scope of practice. So we know that they've had some communication. There's a lot more work to be done. So far, it's not moved the needle very much.
We do have someone who said that as Holistic MDs, they did receive a letter from the FTC, and should we reach out? I'm saying to you at AANP. Can you speak a little bit about, I know that I was reading on your website that you are you're taking out the private information when you're putting this gathering all this information, just so that
Right.
docs feel comfortable and clinicians feel comfortable sending this information. I'm sure people are worried.
Yeah, well, we are definitely not posting anything online on our website, although the FTC will. But if you do want to send us information to help us continue analyzing these patterns, I really would encourage it, because we've been able to pull out some specific examples that we will be bringing to the FTC that highlight, just kind of how overzealous they're being, and to have this conversation about how can we safely educate as a provider community without, them perceiving it as being false and misleading advertising. So those examples that you send to us, we will de-identify them, send them to our attorneys and consultants to help with that analysis, and then we'll use the examples, but in a de-identified way, if it makes sense to use it in our conversations with FTC to highlight where we think there are problems.
That's really great. Thanks for clarifying that. Laura, I just wanted to, take a minute to talk about what seems to be a bit of a philosophical dichotomy, where you have, on the one hand, often conventional treatments being recommended at very high levels within the United States that then later have to be taken back, that literally have no evidence, and what that's creating. And then the really not only inability to share what around an area like respiratory health, or even immune, which is such a broad area and impacts so many other issues that patients are presenting with, especially in naturopathic, holistic providers, and what is seemingly just a closing off to, like, why wouldn't you want to help people be as healthy as possible in every way, especially with what we're dealing with? And I just wanted to say that, it seems like there's two sets of rules right now happening. And I totally support and understand the need to protect the public from harmful things that might be being put out there that really do not have any evidence in any way. And we've all seen that, right? But at the same time, there is real concern around how you could just so broadly start painting this mark on the broader movement and community and philosophy of wellness,
Right.
and being healthy, health creation. That to me is really, really problematic.
Yeah, my community has really struggled with the, it's like this attitude that you can't say anything to empower people to be healthy, to take control of their health, to improve their resiliency, improve the terrain, right? We talk a lot in the integrative medicine community about how do you improve the terrain, how do you remove the barriers that help keep people healthy and that prevent disease. And we're being stifled from being able to talk about those things, to a point where the only recourse that the public has is stay away from each other, social distance, wait for the FDA approved vaccine, which many people won't want to take, or wait until your symptoms are bad enough that you have to present yourself at the hospital. And it's a real frustration, and we certainly don't have a clear answer for it, other than to just raise it and raise the alarm bells of, this is ridiculous. These are really appropriate public health education messages that people need to hear, that people need to take responsibility for their own health care. There are very simple ways, as we all know, that they can do that with proper nutrition and proper supplementation, proper lifestyle choices. We have to be able to talk about those things.
Is there any indication, you talked about several different federal and state regulatory bodies such as the FTC and even the FBI. Has there been any indication that Big Pharma might be involved in some way, or any type of connection there that you can see?
It's a good question. I was asked that a little bit earlier. We have not seen any overt indication of that. So it'll be interesting to hear again what FTC is saying, has prompted their hypervigilance in this area. But it's certainly a concern that a lot of people share of what's behind this, what's driving it, and why is it being targeted at small ambulatory clinics while these large medical institutions are able to dispense the same kind of information with impunity? I don't know. We don't have that connection yet.
I may have already asked this, but for those joining, have you found any specific areas where these are concentrated in the country?
No, it's really been all over the place. From New York, Oregon, California, Kansas, Ohio, Michigan. It's pretty dispersed.
Are there any ways to complain about this as either clinicians or the public? Are there any pathways within any of these organizations where we could proactively be saying something about this?
Right. So that's a good question. There is, for anybody who's familiar with the Alliance for Health, they are a grassroots consumer group that seeks to protect and advance natural approaches to healthcare. They do have a petition out there. The language of it is a little bit more inflammatory than we feel comfortable with. I think it says something like, stop these regulatory agencies from gagging medical practitioners. There's no explicit gag order per se. It's just this is a chilling effect, if anything, on the ability to do education. But that is an option for action. We do have some providers who feel so strongly that this is a really bad slippery slope that they have signed the petition. And the petition does go to, as far as we know, your local governor's office and state, I think state legislators and possibly even members of Congress, although I don't know who they're targeting. Now the question is, and this is the chilling effect of this kind of infringement on free speech, is we know of at least one clinic who signed the petition and they got an immediate response from their governor's office saying, didn't know you were doing this, didn't know this was a concern, can you tell us more? So there's that question of, if you sign the petition, does that put an additional target on your clinic and your business? We don't know, but that's an option. And then this meeting that we have scheduled with the FTC, we're approaching it as an exploratory meeting to try to figure out where are their concerns. Can we come to some compromise about what's that safe space to do education while still selling supplements or having an online dispensary and providing communication with your patients? Depending on how that meeting goes, we may ask organizations, not necessarily clinics, but organizations and associations, to do a sign-on letter to the FTC, encouraging them for some subsequent action, or to write individual letters to the FTC and potentially Congress. So I'm sure that there will be some follow-up. We just don't know what it is yet until we've had a preliminary cordial conversation.
Great. And for people who want to find out more about the meeting and how the FTC goes, what would you recommend? We can certainly, Laura, we're happy to provide an update from you all to our community. And I will encourage people to sign up for the newsletter and to join the AANP. I mean, they truly have been leaders in this area. for the integrative health community. And you have such a really incredible, the updates are phenomenal. I just really want to applaud your team, because I can only imagine the work that is adding for you all to put together such incredible resources around not just this issue, but many of the different issues that are constantly changing with this pandemic.
Yeah, every couple of weeks it changes, right? We have current guidance out. It is on our website. We have decided to make all of our COVID resources available to members and non-members. So the current guidance is on our website under, I think it's how to communicate with your patients. And we will be revising those after the FTC meeting, depending on if we get clarity on suggestions that they have of what we need to do to educate our provider types. So I will definitely be sharing that. And I know AIHM and AANP both are involved with an organization called the Integrative Healthcare Policy Consortium. And I'll be doing an update with them at the end of next week after the FTC meeting too. So we really are working this involves all of us, and we have to fight these battles together. So we've really been working to, I've had conversations with IFM, with you, Tabby, at AIHM, with our dietary supplement industry partners, with the IHPC, as many people communicating as possible so that we have shared knowledge, but also shared strategy of how do we defend our ability to utilize and educate about natural approaches to health.
Yeah, that's so important, Laura. Really right now, for all of us just to be communicating, and certainly I would encourage all of you to reach out to your, everyone has their own networks, whether that includes actual institutions or other clinicians in your area, other integrative providers, whether you're in formal health systems. Reach out and ask about this and start, getting this information out to people so that we can better gather what's really happening and coordinate. Because certainly this is very, where this could go and is going in some of these cases is very concerning for so many different reasons.
And I would offer too that if anybody wants to communicate with me directly, I'm more than happy to do that. My email is executive@naturopathic.org. If you have specific questions, we also have put together guidance for if you have received an FTC letter with some suggestions about how to respond. So I'm happy to share that information too, but we really are all in this together, and happy to help in any way. Keeping the dialogue open is the most important thing.
Laura, thank you so much. And I just want to ask you before we end today, and also thank you so much for everyone that joined us both here in the Zoom and online in Facebook. Have you seen any positive things coming out of all of this in the community? Are there any examples of how the integrative and naturopathic community are helping and finding that help that they're giving received? I know that's a big question, but just to end on a more positive note, you have so much, you're so connected with your community, and I'm just wondering if there's any stories you'd like to share.
Sure. I think, the general pandemic has really highlighted a couple of things. I mean, one is the huge gaps that we have in our healthcare system, which I think is an opportunity for everybody in the integrative medicine field to really step in and take a leadership role in how the solution is not just that you have to wait until you are so sick you go to the hospital. Like, the public is paying attention to this now, and we have seen, ironically, as we're talking about how careful we have to be about selling supplements and stuff, the supplement industry has boomed through all of this because the public is really looking for solutions that they can turn to for their own self-care. And that's a huge opportunity for us to help guide and educate them in how to do that safely and with physician oversight. So that's been wonderful. I think the other thing that's been wonderful is internally to our community, you know, we have a lot of different ways that people practice, and I know that's true in the integrative medicine community as well. We have seen this galvanize all of us toward, I guess, against a united enemy, but into working together and more collaboratively. So I see that in our own profession, but even like having this call and sharing information and us working with IFM and other, we have a whole integrative medicine coalition. The lines of communication are so much stronger than they have been before. And that's really golden. And I hope that we, you know, will perpetuate that and continue it forward, because I think that's how we really will reach more people and make a difference in changing our healthcare system, is by working together. So that's a little golden egg there.
That's a great way to end. And I'm just going to share my screen for a minute. And I do want to, you know, this is just a nice segue, because both the COVID crisis and then everything that has been happening in our country around really uncovering the structural racism and institutionalized racism that we now truly have an opportunity to look at. Although it's been here for 400 years, here we are now with this very unique opportunity to really work towards change. And we are holding, and really a collective, this has become a collective with many different leaders coming together to say, how do we start this conversation within the integrative community to talk about fighting against racism. So I invite you all, we'll be holding the first of a series of community Zoom video calls to first and foremost listen, hold space and share resources, and actively support our Black, Indigenous, and people of color communities. We applaud all of you who are already taking action steps to stop racism and encourage our broader integrative community to find ways to deepen that commitment. So please come and join us. We are going to start this conversation, and we just really are looking forward to helping, like Laura said, bring the community together around these crises so we can really become more connected and more effective and help the communities that we are all serving. So as you all know, we are doing webinars every Monday and Friday. We have a Monday meditation that happens every morning at 8:30 Pacific time, and we have a Friday wellness hour that is this hour here every noon. And then this Sunday we'll be having the special forum on racism. And we just really invite you to connect with each other, with all of our incredible leaders like Laura Farr and the American Association of Naturopathic Physicians. Please use them as a resource. And it's just been a pleasure having you today, Laura. And thanks again for all that you're doing for our community. And we hope to see you all on Sunday and next week. Thank you.